Today we have one more topic about anaerobic infections. Last semester you had this topic about anaerobic infections, about basically about cultivation of anaerobes, right? So, if we are talking about bacterial metabolism and the way of breathing, and as well as you should know, every living organism is breathing. Without breathing, there is no life. Breathing represents the part of metabolism that supposes process of oxidation, process of energy production, process of metabolism. This is why without breathing, life is impossible. So whenever we are talking about microorganisms, we can divide them in more groups. We can divide them in more groups according to their type of breathing. The first group and the mostly common for us is aerobic breathing and bacteria that prefers aerobic conditions. Aerobic breathing means the bacteria is not able to survive and to live without presence of oxygen. That means if we will reduce the oxygen, bacteria will die. If we will take out the oxygen, bacteria will die. Another group are strictly anaerobic microorganisms. That means bacteria is not able to live and multiply in presence of oxygen. So if you reduce oxygen, bacteria will live and survive and multiply. If you will put their oxygen, the bacteria will die. Third group is facultative anaerobic. Facultatively anaerobic bacteria are bacteria that prefers anaerobic breathing. That means it feels better in absence of oxygen. But still it is able to multiply in presence of oxygen. Not that fast, not that good, but still it is able to regulate its metabolism in order to not die in presence of oxygen. So it is a group of facultatively anaerobic bacteria. And the last group is group of capnophilic bacteria. Capnophilic bacteria are bacteria that are multiplying just in presence of CO2. So as much CO2 is around, as better these bacteria will feel, as better these bacteria will multiply. Capnophilic bacteria. And also you should remember from the last semester that there are few ways to provide these conditions for bacteria. So if we are talking about aerobic bacteria, basically we don't need to do anything. We just need to keep proper environmental conditions. That's it. But if we are talking about specifically strictly aerobic bacteria or capnophilic bacteria, we need to provide them with some special conditions. So today we're going to talk about strictly anaerobic bacteria. And the mostly important pathogens making part of strictly anaerobic bacteria are bacteria from the genus Clostridium. These are Clostridium perfringens, Clostridium tetani, and Clostridium botulinum. These are not only 3 bacteria. We also have more bacteria from the Clostridium genus that present interest from clinical point of view. For example, Clostridium difficile. But this one is considered to be kind of conditionally pathogenic bacteria and presents more risks, for example, in non-common infections. But commonly in society, mostly spreaded pathogens will be Clostridium perfringens, Clostridium tetani, and Clostridium botulinum. So let's start with this bacteria. And before we start, also I would like to remind you that according to the shape, we have how many types of rods? According to the shape, we have 3 types of rod-shaped bacteria. Basically, we have spherical-shaped bacteria, we have rod-shaped bacteria, we have spiral-shaped bacteria, comma-shaped. We can have oval-shaped. We can have amorphic, polymorphic. We discussed about that. But if we are talking specifically about rod-shaped bacteria, yes, about rods, about sticks, we can divide them basically in 3 main categories. Bacteria, bacterium. So if you will hear in the name of genus the root bacterium, for example, Mycobacterium, tuberculosis, Corynebacterium, diphtheria. It is kind of rod-shaped bacteria that they're gram-positive, and they're rod-shaped, and they're non-spore forming. This is specific group of rod-shaped bacteria. We can have Bacillus, the mostly common pathogen, Bacillus anthracis, the pathogen that causes anthrax. This is also gram-positive, but already spore-forming, rod-shaped bacteria. With the spore, the shape of which the size of which is not bigger than the cell, than the bacterial cell, so it will not deform the cell wall. And the last one is Clostridium. It is spore-forming, rod-shaped bacteria, also gram-positive. Yes, we have enough gram-positive pathogens. With the diameter of the spore that is bigger than the bacteria itself, and as a result, the spore will deform the shape of bacteria. This is why this bacteria will not be strictly rod-shaped bacteria, but it will have specific enlargement in place of presence of spores. So in dependence on species of Clostridium genus, these spores can be situated centrally, subterminally, and terminally. And you will observe it during the lecture. Now we are talking about Clostridium genus. And let's start with Clostridium perfringens. What is in common in all the bacteria from Clostridium genus? We already talked about them. It is strictly anaerobic bacteria. That means it lives just in absence of oxygen. That makes these bacteria extremely vulnerable in the environment, because basically there are not too much places where these bacteria would be able to multiply. Since our environment basically is full of oxygen, it is very hard to find a place where it is lack of oxygen, so a lot of circumstances should gather together in order to provide these anaerobic conditions naturally for these bacteria. This is why this bacteria has this method of survival. So when you studied last semester different non-permanent structures, non-mandatory structures of bacterial cell, you remember that some non-permanent structures are giving extra features. For example, flagellum is giving motility, pili are giving attachment to surfaces, to tissues. When we are talking about spores and capsule, their function sometimes is misused. Very often we can hear the students are saying that the main function of capsule is attachment. No, the main function of capsule is protection against environmental factors, but mostly against phagocytosis. And the secondary function, like it can have also function of attachment, but it is secondary function. But mostly the mostly important organelle or structure of attachment is pili. Now, when we are talking about spores, very often students are saying the function of spore is reproduction. So please don't misuse with fungi. They are multiplying by spores. Some by binary division of fungal cell, but some of them are multiplying by spore production. Spore-forming bacteria, it is not the function of the spore to reproduce. It is the function of the spore is to protect what? To protect. But not, it is to protect, but not bacteria. Bacteria will finally die. It is, the function of the spore is protection of genetical material. So it is protection of, let's say, offsprings. But reproduction, all the bacteria are reproducing by the binary division. It is the only way of, let's say, the main way of reproduction of bacteria. And spore formation could be indirectly a method of reproduction, but basically it is way of protection of genetical material. So it doesn't make any sense that something that is inside the cell protects the entire cell, right? If the spore is inside the cell, it is not able to protect the cell. The cell does protect the spore. So, or it carries the spore until the moment the cell will die. But the capsule is around the cell. This is why the capsule protects the cell. Okay, so we reminded a little bit about basic morphological and physiological features of bacteria we passed last semester, and let's apply all of these to these three pathogens. Starting with Clostridium perfringens. So all the time you are talking about Clostridium genus, you are thinking about all the features we discussed right now. Most of Clostridia can be found in the soil. And now here is my question. In the soil, you will find bacteria or spores. Who is for bacteria? Who is for spores? And who is not listening? Mostly, you will find spores. Why? Because soil, as the entire environment, is full of oxygen. It has pores through which the air with oxygen penetrates in the soil. Without oxygen in the soil, all the processes of circulation of the organic and non-organic substances that is provided by saprophytic bacteria. Think about it. Saprophytic bacteria are keeping our ecosystem on the entire world. So without oxygen in the soil, all of these processes wouldn't be possible. This is why you keep in mind the soil is full of oxygen. That means Clostridium genus is not able to survive. Species of Clostridium genus are not able to survive in soil. This is why you will find in soil a lot of spores of Clostridium genus. Talking specifically about Clostridium perfringens, it is the pathogen that mostly produces gas gangrene. Talking about the shape, we already discussed features, morphological features of this bacteria, but what is important to underline talking about Clostridium perfringens, their spores are situated either centrally in the middle of bacteria, either subterminally, so between edges and middle of bacteria. So this is how you differentiate Clostridium perfringens from other bacteria. Spore will be situated, as well as you can see here, either centrally, either subterminally. Since you already heard you already know it is gram-positive bacteria, we can apply gram staining, and it will show that it will show all the structures, all the main structures of Clostridium perfringens. What is also specific about Clostridium perfringens, it is non-motile. Because some of Clostridia are motile and some of Clostridia are non-motile. So, talking about Clostridium perfringens, it is gram-positive, rod-shaped, spore-forming bacteria, non-motile, and with the spore that the shape of which is the size of which will deform, which will be bigger than the bacteria and will deform the bacterial cell. Physiology we already know. It is strictly anaerobic bacteria. That means we need to provide some specific conditions. And mostly, Clostridium genus prefers, except anaerobic conditions, it will prefer humans' proteins. This is why one of the mostly common culture media will be blood agar. I don't know how proper is visibility of this picture, but the shape of colonies will be, it is R form, And by the way, on the culture media, you can observe that this bacteria is non-motile, because here you can see one colony of Clostridium perfringens, and it is, even if it is large, it is large basically because it is R form. But if you will compare it to other Clostridia, you will observe that the motile ones will have kind of waves on the culture media. So we will see it later. But this one is, you also can observe, even on culture media, ability of movement or motility of bacteria. And let's pass directly to the nosology, or to the clinical picture of gas gangrene. You must know that gangrene is a process of necrosis resulted by lack of oxygen supply, result of lack of bloodstream supply in tissues. So if by some reasons some tissues will not be provided with fresh bloodstream and will not be provided basically with oxygen, we'll start the process of necrosis. And it is important to be able, first of all, to differentiate necrotic process from inflammatory process. And second, it is important to differentiate regular gangrene from gas gangrene. Here you can see on these pictures examples of gas gangrene. And if you will Google the regular gangrene, I will add it soon in the slide. But if you will look for a picture of regular gangrene, you will see the big difference between gas gangrene and non-gas gangrene. If we don't have a blood supply of tissues, and we don't have oxygen supply of tissues, the necrotic process is starting, and basically all the tissues are dying, and they get more dry, no water supply, no oxygen supply, and they're dying, and they're getting dry, and closer to black, greenish black color. If we're talking about gas gangrene, it is also lack of oxygen, but not due to lack of blood supply and oxygen supply with the bloodstream, but because of multiplication of Clostridium perfringens in soft tissues that is able to produce gases, and this inflammatory process will block all the metabolic processes, including bloodstream. So everything will start stuck in the same place. We have liquid supply, we have blood supply in tissues, but bacteria multiplies, it produces toxins that increase the inflammatory process, and produces gas that also will enlarge the tissue and the pressure inside, and it will stop oxygen supply. And it is a kind of cascade, because of less oxygen will come in tissues, as better bacteria will start multiplying. As better bacteria will multiply, as stronger will be inflammatory process, as worse will be the clinical picture in this case. So you can see to what it could lead to such kind of inflammatory processes. And you can differentiate it not just visually, not just by inspection, not just by looking, but also by palpation, by touching. So if you will touch the soft tissue affected by gas gangrene, you will hear and feel such sound that is called crepitation. It is like explosion of small bubbles. So it will be, I will try to show this sound like this kind of sound is called crepitation. So it is explosion of small bubbles of gas inside of the tissue. So when you touch the soft tissue, you will hear this sound, and you will feel this very fine vibration during explosion of these bubbles. So it is how we differentiate simple gangrene from gas gangrene. If you will do the same thing with regular gangrene caused by trauma, by any other processes, for example, thromboembolia can cause gangrene because of obstruction of vessels. So you will touch the soft tissue. It will be kind of like wood. You touch the wood, so, kind of that. So it is very simple. It is very easy to differentiate these two types of gangrene. How it happens? Nowadays, it is very important to know how it happens, how you can get infected. And basically, anyone can get infected with this pathogen. If we are talking about gas gangrene, it is the mostly common event, or very common, not mostly, but very common event during military actions. During military actions. So, since the tension in the world is very high, there is very high probability of military contacts or impacts in different regions, including our region. It is very high probability, including our region. We already discussed that the entire soil around can be full of spores of Clostridium. And it gets in the soil from animals and humans' intestine. So some Clostridia are present in the intestinal tract. Even spores of these bacteria are present in the intestinal tract of most of animals and some of humans. This is why soil is full of Clostridium, because animals are everywhere. Now imagine the classical military action doesn't happen in the sterile environment. Usually it is called battlefield because it is outside. It is in the field. It is inside or outside of the city. Dust is everywhere, soil is everywhere, and a lot of injuries around. In order to get infected, it is important to have a deep wound with soil or dust contamination. So, very high chance in mass of a lot of injuries with deep wounds, especially of extremities, limbs, and contamination with soil. Yes? Also, it can happen after a car accident, because there also we have very strong contamination with soil, and if it is a strong impact, we have contamination, we have deep wounds. So, as soon as the spore of bacteria will get in the place, it will feel more comfortable. And as soon as anaerobic conditions will be provided, and how we can provide anaerobic conditions, if you didn't wash the wound good enough, and after that you put it the bandage, very good, very strong, because we need to stop bleeding, we need to take care of the patient. So sometimes this bandage is too strong and too hermetic that it helps in creation of anaerobic conditions inside of the soft tissues. And not every time it is really possible to bring the patient very fast in the hospital for proper treatment. So during this transport mission, during you try to deliver the patient in the hospital, and you close the wound hermetically. Moreover, you don't have too much materials and time to change the bandage as soon as it gets dirty. So, in this way, we create very proper conditions, very good conditions for Clostridium genus to germinate. That means to transform from spore to vegetative form of bacteria, and to start multiplying. As soon as it starts multiplying, it will start producing such consequences. What is important to know? Lab investigation is possible not before, but also after treatment. This is why, if we already can see all the symptoms of gas gangrene, first of all, we should start the treatment. And after that, we put aside some samples and we make lab investigations just for legal side of the issue, just to confirm legally the diagnosis. But basically, we don't need lab confirmation for this infection, just to apply the best treatment. We already know how to apply the best treatment. And which is the best treatment for gas gangrene? Amputation. Yes, we're not talking about antibiotics, we're not talking about antitoxins, we're talking about amputation, because from the moment we're talking about gangrene, that means it is necrotic tissue, and it is irreversible process. You cannot treat it. You can just remove it in order to stop spreading. And you should keep in mind, it is a process that spreads, that develops extremely fast. So if today you will not cut, I don't believe all of this stuff, so I will show one myself. If the necrotic tissue is, necrotic process is till here, we should cut from here, upper, in order to make sure the necrotic process didn't affect healthy tissues. So, we make amputation. If today I will not cut from here, tomorrow I will need to cut from here. And it is very hard to cut from here because it is chest. So as soon as you detect the gangrene, as faster you need to take the decision of amputation. It is extremely important if you want the person to survive. And of course, it doesn't mean we reduce absolutely all of other treatments. First line treatment is amputation, and next we apply antibiotics, analgesics, anti-inflammatory drugs, antitoxic treatment, and so on. It is very important to put all of them together, but moving step by step, working from the first line treatment and to the next step. And after that, we make lab investigation. After we are sure that the patient is safe, we make lab investigation. So you should remember from last semester that there are four types. There are four types of methods of creation of anaerobic conditions: physical, chemical, mechanical, biological. And this classification we also have in other ways. But talking about creation of anaerobic conditions: physical, chemical, mechanical, biological. Talking about biological, we put on the same Petri plate two different types of bacteria, aerobic, anaerobic. We cut out from the middle one line of piece of culture media. We create a hermetical environment, like we close it with paraffin or with Vaseline. We close the Petri dish and we put it in thermostat. First we'll multiply aerobic bacteria. They will consume all the oxygen from the Petri plate, and after that the stage will take anaerobic bacteria because there is no oxygen anymore. It is biological. We are using one living organism to provide anaerobic conditions. So we don't need these aerobic bacteria to multiply for investigations. We just use them in order to produce anaerobic conditions. It is about biological. Physical, very often you misuse physical with mechanical. Physical means we apply physical environment, physical factors. And physical factors can be heating, can be burning, can be humidity, can be pressure. But here, when we pump out the oxygen, it is not the pressure the main feature. The main feature is mechanical removal of oxygen. So we are not interested actually about low or high pressure. We don't care about pressure. The pressure is kind of side effect of pumping out the air. So this one is mechanical. We mechanically, by using mechanical force, we remove the oxygen. Why you also very often misuse physical with mechanical? Because who is going to the gym? Anybody is going to the gym? How do you call it? Physical activity, yes? Wrong. If we turn on the nerds mode, it is not correct statement. Physical activity is mechanical activity, because mechanically you lift something and you put it back. You move something. It is mechanical work, it is not physical work. Physical work should include physical processes. That is temperature, that is humidity, that is... Yes, the temperature will increase in the gym. Yes, humidity also will increase. Because you are working, you are producing the energy, and you're sweating. So, but it is side effect. It is not let's say not side effect. It is effect. But it is not the target. Target is, it depends. Somebody wants to remove some extra kilograms. Somebody wants to add some extra muscles. But actually it is mechanical work and it is not physical work. But we are used with this word, physical work, the physical activity. This is why we are were exposed to this misusing of physical with mechanical. So physical is when you take a Petri plate, you put it in a glass jar, you close it hermetically, but before you close it hermetically, you put a candle near the Petri dish. You turn on the candle, you put it on fire, and you close the jar hermetically. We are not interested in heating. We are not interested in increasing temperature. We are interested in removal of oxygen. So one of the best ways to remove oxygen is to burn the oxygen. If you will burn out the oxygen, there is no oxygen there. Yes, also you will create negative pressure. Also you will create some extra heating, some extra temperature. But it is not a target. It is just a side effect of the process. So it is a physical way. We burn the oxygen. Chemical way, it looks similar to a physical one, but instead of a candle, we put in a jar a gas pack with some special chemical substances. When you mix these substances, the chemical process happens, process of oxidation. So the oxygen is replaced with CO2. It is the best way to multiply capnophilic bacteria. It is a chemical way. So, physical, chemical, mechanical, biological. And this one, it is the mostly common and the mostly comfortable way is mechanical. We have this device that is called Anaerobic. We have a special stative for Petri plates, so we can put more than one together. We put it inside, we close it hermetically, and we pump out all the air from the inside. Here we have a barometer, the device that shows us pressure. But again, we are not interested about low pressure, but the low pressure will prove that we removed oxygen. It will be indirect sign for us that we removed all the oxygen with the air. So we provide these anaerobic conditions, and after that Clostridium is able to grow, to multiply. If after incubation in anaerobic state nothing grew up, that means we didn't have there any anaerobic bacteria. If something grew up, that means we have anaerobes. And also we discussed about other ways of lab investigation. So before you can make other ways of lab investigations, you need actually the material. So we can make gram staining of necrotic tissues. So you can see it here. We take necrotic tissues and we make gram staining, so we can differentiate other cells and other matter from Clostridium. And you can see this bacteria in the tissue. About the treatment we discussed. First of all, surgical treatment. After that, antibiotics. And by the way, it is very important to apply hyperbaric oxygen therapy. So the affected person is placed inside of the baric camera. It is a big camera in which we provide extra pressure. More pressure we have, more oxygen we have. So we are not interested specifically about pressure. Yes, pressure also helps us to helps the oxygen to penetrate deeper in tissues. But basically, more pressure we have, more oxygen we have. Less pressure we have, yes, anaerobic state. Less pressure, less oxygen. So in hyperbaric oxygen therapy, we put a person in hyperbaric chamber and we pump the air in with extra oxygen. As a result, more oxygen will circulate inside of the body and it will increase the therapeutical effect of precedent actions like amputation, antibiotics, and so on. And how could we prevent gas gangrene? It is basically, first of all, prevent injuries. All the prophylactic measures of bad, deep injuries is as a result of prevention of gas gangrene. And if you provide a person with first aid after such impact, it is very important first of all to apply H2O2. Yes? It is very important to apply. Why? First of all, it washes the wound the best, better than anything. And second, it has extra oxygen. So the wound is provided with extra oxygen. Plus, it is not aggressive substance, and it will not damage non-affected cells in damaged tissues. It will destroy destroy and wash out just destroyed cells. So this is why it is absolutely harmless to put inside of the wound. It is the best thing you can ever put in the wound is H2O2. Yes? And after you apply it or measures to stop bleeding, you should make sure that the bandage is not too hermetic before you will send the person in the hospital for the further treatment. So you make sure there is no bleeding, the person will not die in the way to the hospital. There is no dirt in the wound. You remove as good as it possible this dirt from the wound, and you do not apply too hermetic, too close bandage on the affected region. And next, the doctor, the experienced surgeon, will cut out everything is to be cutted, and will put all the sutures just in the way. It will also prevent the gas gangrene with drains, with daily wound care, and so on. Next pathogen is Clostridium tetani. It is the pathogen that causes tetanus, and probably this pathogen is very common for you for a few reasons. The first one, I guess all of you or all of us are vaccinated against tetanus, right? And you should keep in mind, there is a triple vaccine, DTP, diphtheria, tetanus, pertussis, that turns into TD vaccine in adulthood, starting from 20 years old, and every 10 years everybody is to be vaccinated against diphtheria and tetanus. Last week we've been talking about diphtheria, today we are talking about tetanus. So it is the vaccine that is provided by one shot against in the beginning for children in against three infections: diphtheria, tetanus, pertussis, and in adulthood, diphtheria, tetanus. First one. And second one, I guess for most of you, such event is familiar, is common. When you are walking around and you step on a piece of wood with a rusty nail. Did you ever have such event? Who did ever step on a piece of wood with rusty nail? Huh? No one? Just me? In your childhood, didn't you walk around old houses in a village somewhere? Or did you? No? You didn't have a childhood. So, the mostly common event for infection with tetanus is walking in the place, could be rusty nail. It is the mostly common event. This is why very often students are misusing tetanus with rust. Like they're thinking that if there is a rust, there is connection you make. If there is the rust, it is chance for infection with tetanus. It is not direct connection. There is no direct connection. Tetanus as well as Clostridium tetani as well as Clostridium perfringens you can find in soil. And piece of wood with rusty nail you also can find not on the floor in the house, not on the road or somewhere. You can find it maybe around the house if you are from the rural area. If you recently changed something in your house and you didn't succeed to throw every waste, every construction wastes out, and you stock them around house, maybe I will need it somewhere. So children are running around the house, and there is a high risk to step on a rusty nail. And if it is around the house, the probability for the nail to be contaminated with soil is very high. This is why, and the rust is not smooth. It contains enough soil, so it contains enough pathogens on it, including spores of Clostridium tetani. In this way, and it is very important, when you step on a rusty nail, you create a deep and narrow wound. Deep and narrow. That means when you will work it, when you will wash it out, there is a high chance you will not wash it properly. And the dirt will remain inside. And the skin will regenerate much faster. And your body itself will produce anaerobic conditions for the pathogen. So the Clostridium will, the spore will germinate and will become a vegetative form of bacteria. And by the way, in comparison with Clostridium perfringens, Clostridium tetani is motile. So, it is able to move. It will multiply, it will move as it possible inside of tissues. If you make cultivation on culture media, you will see the colony, and around the colony one wave, and one wave more, and one wave more. So like rings around the colony, rings of new colonies. So they are moving around. This is how you differentiate Clostridium tetani from Clostridium perfringens on the culture media. And it is extremely toxic. That means it is produced. It does produce tetanic toxin. Tetanic toxin is a kind of toxin with a specific action. Why tetanus is called so? What means tetanus? If we are talking about mythology, it is someone that is extremely strong, yes? And if we are talking about chemistry, about metals, titanium is one of the mostly strong metals. It is light but strong. So this infection, this disease, tetanus, is called so because of contraction, very strong contraction of muscles. Because of this titanic toxin, titanospasmin. This toxin have specific function. As well as you should remember, our muscles, they have double function. All of our muscles, they have double function. Is contraction, is relaxation. And also we have mainly two mostly important groups of muscles. We can divide all the muscles into groups: flexors and extensors. So when we are talking about contraction and relaxation, these are two opposite functions of muscles, and when we are talking about flexors and extensors, these are two opposite functioning muscles. Titanospasmin, this titanic toxin, has a function that blocks the second function of muscles, relaxation. Our nervous system, in order to produce contraction and relaxation, is producing neuromediators. These neuromediators are making balance between contraction and relaxation. These neuromediators are produced constantly. You can observe it. You can observe it by checking your muscular tonus. You have it. You may be not observe, but if you will try to lift the hand of your neighbor, you will observe it will not fall. It will not fall because your body keeps this balance. Right now, maybe I'm not moving, but my muscles are in a balance, and almost all of you, except those who are sleeping, are keeping this tonus, are keeping this balance, just to not fall and to control its body in the environment. So these two neuromediators for contraction and relaxation are working and are released all the time. Now, titanic toxin, titanospasmin, is blocking the function of relaxation. As a result, is released and is in action just one neuromediator that gives just contraction. Now, if you will compare what is stronger, flexor or extensor, you will observe that in most of parts of your body, flexors are stronger. It is easier, it is harder to reduce flexion, not extension. Yes? Flexors are stronger. If we are comparing spine and abdominal muscles, the spinal muscles will be stronger. And just if we're talking about legs, about feet, we have some balance between flexors and extensors. But basically flexors are stronger and spine is stronger. So if you will see the person with tetanus, what can you observe here? Contraction of flexors will be stronger. Contraction of spine will be stronger. Just legs.
will be in balance between them. And here also you can see contraction of flexors, which is stronger. So all the muscles will contract, but this competition between flexors and extensors, of course, will win most of flexors, spinal muscles, and legs. The entire muscular part of legs. So this is clinical picture of tetanus. What makes it more complicated? The person is in full consciousness. The person understands what happens and can do nothing. And all of these are supplied with the extremely strong algic syndrome. So it is very painful process. And if you will not apply treatment on time, the person can die because of several reasons. Asphyxia because of contraction of diaphragm and the person and intercostal muscles, and the person is not able to breathe anymore because of pain and because of column fracture. This is what can happen to a person who is not treated on time. Now, lab investigation will be the same for tetanus as for gas gangrene, but the difference will be that also we don't need to make lab investigation to apply the treatment. You cannot misuse this clinical picture with anything. So also by emergency we should apply the treatment. And the first line treatment for tetanus will be antitoxic treatment. Antitoxic serum that will inhibit, that will neutralize function of tetanic toxin and will release this. If we will neutralize the tetanic toxin, our body will start producing neuromediators that gives relaxation, and the person will start getting relaxed. Second line treatment is antibiotical treatment, and next drugs that help myorelaxants, analgetics, anti-inflammatory treatment, and so on. But the first line treatment is antitoxic serum. And of course, we shouldn't forget about vaccination, because it can happen in any kind of injury with a deep, narrow wound contaminated with soil. So it is not just a rusty nail. It can be car accident, it can be anything. So today, probability to get in a car accident is much higher even if you are in your bedroom. Yes, if we compare airplane crash and car accidents, it is much higher probability to get into car accident while you're in your bedroom than to get in the airplane crash if you are in the plane actually. So nobody is protected against such events that could infect you with tetanus. This is why if some of you are already 20 years old and you didn't get vaccinated against diphtheria and tetanus, please, you can do it even in a university clinic. Same thing. And the last one, botulism.
Doctor, it's used in botox.
Yes.
For cosmetic.
the first thing that I guess already almost everyone knows, that Botox is botulinum toxin. Yes, that is used in cosmetics. Please don't misuse with fillers. Some girls are pumping in their lips and other places, and not just girls sometimes, but I can barely call it men. Okay. So, by the way, they also cannot call them. So, no offense. But Botox is not the same thing as filler. Botox is botulinum toxin. It plays the same role and it gives the same function. It is injected under the skin under facial skin in order to paralyze for a while mimic muscles. Can you imagine you paralyze your face in order to not have wrinkles? I can understand this action just for one thing. If you're a professional poker player and you really need it, it is your income source. Okay, maybe it will help you, but still I'm not sure. But as well as one professor told, I love it so much. I don't understand why people are so afraid of getting old. Why? It is not a disease and it is not a danger. It is a privilege that achieves not everyone. Not everyone is able to achieve getting old. Think about it. What is more dangerous, to get old or to not get old? I would prefer to be old. So why should we be afraid of getting old? First. And second, there is no invasive procedure that passes without any consequences. So if it is an invasive procedure prescribed by clinical reasons, so the person needs it because of some diseases. Okay, all the risks and all the side effects are lower than beneficial results. But if it is just it is my caprice. All the consequences you can get are not better than the final result. So it is about cosmetic industry. But if we are talking about the infection itself, first thing you should keep in mind, botulism is not infection. Botulism is food poisoning. So talking specifically about clinical manifestation of botulism, you should keep in mind, first of all, it comes, if it is food poisoning, it comes from affected food. Why it is not infection? Because if you will swallow botulinum spores or the vegetative form of botulinum bacteria, Clostridium botulinum, in most of cases it will produce zero harm to you. But if you will consume the food in which Clostridium botulinum multiplied in anaerobic conditions, that means this food is full of botulinum toxin that has paralytic action. And you can compare with tetanus. Tetanus has opposite function, contraction of muscles. And botulinum toxin has a function of relaxation, but pathologic relaxation, yes? So it is it neutralizes function of contraction. So the muscles all the time are relaxed. Paralysis is the ongoing relaxation of muscles. You cannot do anything. Maybe you feel it, but you cannot move it. And this botulinum toxin, it depends of dosage you applied or you consumed, starts working from up to down. And if we do not start the treatment on time, first symptoms are starting with crossed eyes, because muscles of eyes start getting paralyzed one by one. So the person is not able to concentrate the vision, and you will see crossed eyes, and the patient will not see properly everything around. After that, paralysis of faces muscles, of mimic muscles, starting from up to down. So finally the person is not able to talk normally because the muscles of the head region are affected. In tetanus, the person is also not able to talk normally because of contracted joint. But in botulism, the person will not be talking normally because... Can you hear the difference? Tetanus and botulism. Tetanus and botulism. Can you see the difference?
Yes.
So, and the paralysis is going, as well as I told, from up to down. And the mostly dangerous thing is when it can paralyze your respiratory system, and you will stop breathing. Same as in tetanus, but in tetanus because of contraction of respiratory muscles, and here because of paralysis of respiratory muscles. There is no difference from which reason to die, because of contraction of muscles or because of paralysis of muscles. The result is the same. You're dying. So it is very important to prevent it, because if you start the treatment on the initial process, initial symptoms, the process is reversible and all the functions will come back. But if you start the treatment late enough, most of symptoms will remain forever, because nervous system is very hard to regenerate. So as later you will apply as faster you will apply antitoxic treatment, as faster, as more chances you have to have reversible affection. And since it is not an infection, you should keep in mind that we don't apply antibiotical treatment. We do not fight with bacteria. We fight just with the toxin. Where you can get it from? First of all, homemade cans. Homemade cans, and mostly meat on the first place. Meat and fish on the first place, but basically meat. Mushrooms on the second place. Vegetables and fruits on the last place. What is also specific about botulism? If Clostridium botulinum multiplied in can, you will not feel any difference. The smell, the taste, the color will not change, unless it is affected also by other bacteria. If first aerobic bacteria multiplied them and spoiled the food, and after that, after they consumed the oxygen, Clostridium multiplied there. In this case, you will see the changes, but not because of Clostridium botulinum, but because of other bacteria. Same thing. It is important to keep in mind to not consume cans that are older than 2 years, especially if they're homemade cans, because in home conditions you don't have enough facilities to sterilize properly all the products you are conservating in cans. And also you can check even in the store, if you're buying some cans, on the top, on the cap, there is a button. When you open the can, this button will lift, and you can press it, and it will play up and down. But unopened can is with negative pressure, and the button will not play. You cannot press it. So if you are going to the store and you are able to press this button on the top, kind of, yes, that means either somebody already opened it, maybe to check it out, is it good or not, and put it back. That doesn't make too much sense for me. Either it is spoiled, but in any case, it is very dangerous to take and to consume this can. And at the same time, if you conserved it home, and some of them are playing before you open it, it is not safe. You should keep it in mind. So don't consume too old foods from cans, and make sure everything was sterilized, everything were closed hermetically, and the button on the cap doesn't play. Okay, so it is the best prophylaxis. Make sure that everything you consume is safe. Any questions?